One show gives you the information that can change and shape your life. The IMA Doctors get straight talk and honest answers to your healthcare questions from the team of doctors at IMA Healthcare.
We are live from IMA Healthcare today for the IMA Doctor Show. Today we have Dr. Jessica Kuhn, a board-certified pediatric nurse practitioner with IMA Healthcare Kids Care, and she provides primary care to children from birth to age 21. And Kathryn Gray, a physician assistant who sees patients of all ages with a special interest in women's health. Welcome to you both. Thanks for having us to your house today.
Yes, thanks for coming.
Let's dive in. We are into summer, full swing. We were actually even talking about all the summer woes of our own children before we got on the air. So let's talk about some of the summer safety tips for the kiddos. One thing I'm curious about, and we hear about it so often, is hot cars. Obviously, the top story in the news about hot cars are these like squishy toys that are getting left in the hot cars and then burning kids. So that's one thing to watch out for. Obviously, we don't want to leave our kids or pets in a hot car, but what about other medication, not just toys that may be burning our kids, but let's talk about those other things like medications, EpiPens, insulin, inhalers. Does it impact the effectiveness to be left in a hot vehicle?
It absolutely does, yes. So some medications probably would be okay if they were in the sun or got to a warmer temperature. But for most medications, we say you want to keep them in a cool, dry area. Both sunlight and heat could denature the medications and or could render them either less useful or sometimes actually more potent, which could be worse.
Oh, so interesting.
I would say don't leave them in the car.
So what about even just like, I know, now that I'm thinking of it, I probably have some like children's Tylenol or Motrin or Benadryl in, my car, just kind of always there. JJ also learned I randomly have earplugs in my car at any given time, like the disposable ones, because also kids need earplugs a lot more than you think they do. That's just a thing. What about those kind of things? Like those probably should be thrown out and I should probably replace those too.
Absolutely, because especially in North Dakota, we have cold temperature as well. So those medications also can freeze in the winter, and freezing could wreck them as well, or make them more potent or less potent.
Yeah.
So if you need kids medication, chewable. I would do like a chewable Tylenol. You'd be better off with that. The liquid stuff is going to be affected way worse than a tablet, a capsule, a chewable.
Yeah. You're just trying to have everything in the car at all times, but it doesn't really work for, especially those EpiPens too. I know we have two people in our house that have to have EpiPens, and it is, let's just name it. It's hard to navigate that in the summer because you always need it with you, but where are you going to leave it? And it just needs to kind of be on you at all times.
Yes, probably in your purse or backpack would be the best, even a waistband.
Yep. Yeah.
And I do think that they make the little carry things that have some insulation to them so they don't get too hot or too cold.
Oh, that's a good idea. I hadn't thought about that.
And of course, if you also shouldn't be putting it, like, let's say, in a cooler, right? Because now you're putting it next to ice, so you're getting the other extreme side of the temperature.
Right.
Yeah.
Oh boy, I've never put this much thought into like how I need to bring these along with me.
Well, but luckily for most of us, most of our medications can be tablet or capsule form, and that's less. I would say it's less of an issue of having it in the heat or in the cold. I'd still say avoid it, but for the most part, it's the liquid medications that you really don't want to have in the heat.
Sure.
Let me ask a question about taking medications, because this came up over the weekend where I was looking through a hotel and there were no clean glasses, and I didn't want to, drink directly from the faucet of a hotel. And I thought, I'm just going to take my medication with a swig of Diet Coke. Taking medication with something other than water is a yay or nay?
Does it matter?
I don't, I suppose most of it probably doesn't matter, especially if it's tablets, capsules, it probably doesn't matter.
Okay.
Very few. Yeah. Right. Like there are some medications that, but it should say on those, take on an empty stomach. Mm-hmm. Those I would say I wouldn't do with anything more than water. But for the most part, it shouldn't matter what you're drinking.
Sure. It's all getting to the same place.
Right, I was just thinking, like, okay, so, there's carbonation. You talk about, like, a Coca-Cola can dissolve a tooth, right? So should I be taking a time-lapse medication. Isn't that the truth? Isn't that like if you leave
Have we tested that?
Wasn't that what everyone's saying?
Right.
It does clean pennies and toilets.
Right?
It takes rust stains out of toilets.
Compounded exposure over time, right?
Wow.
Yeah, no one's holding Coca-Cola in their mouth for like 18 hours. I hope not.
Well, right. No,
That'd
I know,
be a weird
but
TikTok challenge.
I just never. Now I need to see evidence of this.
Okay, I'll bring you to like a third grade science fair. We'll go straight to the source. Hey, speaking of things
Actually,
to drink,
we should give that to a third grade. Where are they going to find a real tooth, though?
because they're losing teeth themselves.
That's true.
Third graders have the most access to teeth outside of the dental profession of anyone in the United States, bar none.
You're not wrong. Actually, I would say first graders. That's when you lose the most amount of teeth. Is that between kindergarten and first grade? Third grade, you're kind of your teeth losing years are sort of like you have a lull in about third grade where you're not losing as many.
Okay, I mean, I was just trying to make a funny joke, and Amy's sitting here being like, the timeline of teeth look like
we'll
this.
say school age.
We'll say school age. Well,
I
it's
like that.
very ever present in my house because my son isn't losing as many teeth, but his sister is, and so there's a lot of teeth discussions in our house right now. So you're right. We do have access to a lot of teeth.
Yeah.
You're right.
So you should do the experiment.
We should. Yeah. We'll start one tonight.
Be like, the tooth fairy told us that it's okay to keep this one back. They're still going to pay you for it. But
the tooth fairy in our house doesn't take the teeth because one time I think the tooth fairy forgot to take the teeth. And so then I had to explain that our tooth fairy has an abundance of teeth and didn't need theirs anymore. And so the tooth fairy just like leaves something but doesn't take the teeth in our house. I don't know about everybody else's tooth fairy.
Plus, it's kind of creepy, right?
Right.
Like,
super
as a kid,
creepy.
I would think about like,
why do you need my teeth?
and where are the teeth going? And
Where
what
are
you
they?
doing with them?
Yes. Yeah. So my tooth fairy doesn't take teeth anymore. Okay. Glad we got to the bottom of this.
Hey,
What's the going rate?
Hold on. Dr. Blankenship just walked by, and he did not take a sweet treat. Went out with a bunch of people, didn't take a sweet treat, came back in. I want to know, what was the thing that he wanted that wasn't out there?
Diet Mountain Dew.
That's true. That's true. Yep.
You don't have a frozen Diet Mountain Dew out here available?
Actually, have you had a frozen Mountain Dew?
No.
7-Elevens used to have them.
And they're good.
Like when I was in like high school. And that's the glory days of really bad food content. You know what I mean? And
Yeah,
so,
don't take your pills with a frozen Mountain Dew. I think I'm not a medical
they were
professional,
really
and I
good.
can tell you that's one
They were
not to
really
do.
good. Okay, we've gone off the rails already.
Listen, I want to talk about hydration because dehydration seems to be rampant, right? And so we're talking about beverages. Let's talk about what the signs are of dehydration because I think it creeps up on people, and it's not just like, oh, you just need to like get a glass of water and you're going to be fine. Who wants to tackle dehydration in the summer?
Well, and also with the explosive diarrhea conversation.
Yes.
Can we talk about that for a minute? Like, when is diarrhea not explosive? Like, is there a calm diarrhea? I don't really understand the headlines about it. You guys kind of agree, right? Like, we're a little bit confused about the headlines. But that's been sort of the headline of that problem is the dehydration aspect.
Right, because you have so much, right, that's consistently coming out, right, that you can get dehydrated pretty fast. So,
is the skin pinch trick real? Like where they say, hey, if you pinch your skin and if it doesn't go back, like that is a sign of dehydration?
Right. So if it stays tented up, so we call that turgor.
Okay.
Right, turgor. Yes.
How are you doing?
So
where?
If you
Where should I be?
So
You're a little dehydrated.
So if you pull, so if you pull on the top of a hand and it stays tented a little bit, then you haven't had as you haven't had as much for water.
But now, if you're really dehydrated, it will stay.
It will stay.
Really?
I mean, we're talking not like bounce back at all, but you'd have to be pretty dehydrated.
Okay.
So, and that would be, I mean, we're not going to go around pinching people, right? So, I mean, I think it's more like, how do they look? And what have you been doing? So for kids, it's tough because they're not going to notice some of the early symptoms, which are dry mouth, feeling fatigued, because they're running, jumping, playing, having fun. But if they've been doing that excessively or a lot and they're in the heat and they're sweating, push fluids. Like, we don't want to wait until we see the symptoms. We want to treat ahead of time. If they haven't gone to the bathroom to pee in 4 hours, they probably need a drink. a lot more than they are.
Yeah.
I mean, a good rule of thumb for kids, I usually say they should be at 40 to 60 ounces a day at a minimum. But now if you're sweating because you're playing outside or you're in activities, you should be increasing that number significantly.
Have you seen a lot of kiddos with dehydration, or are you fielding calls about it?
I think most of the kids that I've seen with dehydration, it's not due to the heat and being outside. It's more so, and most of the mild dehydration we can manage at home, right? But it's more of the sick kids. Now, if you have a stomach bug or if you have upper respiratory and you're not drinking as much as you usually do, those times you need to be drinking even more because they're eating less, so they're getting less fluids just in general. So fluids. And water is probably the single best thing. I mean, when I tell people, it's like drink the water. If you're going to do some sort of a rehydration solution, the Pedialytes or Gatorlights, I don't love the Powerades, Body Armors, Gatorades because they're full of sugar. And so that can cause opposite problems. And we get stomach upset or we get loose stools. Well, now we're just encouraging more dehydration. So your lights, your Pedialytes, your Gatorlights, not your Powerade Zeros, but the Pedialyte type things are best.
What do you think about the things like the liquid IVs? Because I noticed that people just go gaga for putting those into water bottles.
They're good for rehydration. They're not something you should be just having with all your water. Okay. You're better off drinking water throughout the day. You could maybe have one liquid IV pack. Element is another one, the salt water packets. Mm-hmm. Those things are great. It's the same concept. You're getting electrolytes, but we shouldn't necessarily need those unless you're dehydrated. So water is adequate. And on a day-to-day basis, you wouldn't want to be adding those things because they do have, a lot of that stuff does have sugar in it. So we're just adding extra sugar into our diet that we don't need.
What about pickle brine? I feel like everyone says, after a workout, I chug a bunch of pickle brine.
Okay, you love to
because
drink
it's
pickle
electrolyte.
Brine. JJ
but not after a workout. I'm just drinking it to have fun.
JJ just wants someone to tell him that it's really good for him so he can keep drinking it on a regular basis.
But I know people who drink it every single day.
There are people.
What do you think about pickle brine?
For the average person, it's probably not necessary.
Okay.
I mean, unless you're excessively sweating and doing a lot of workout where maybe that would be helpful with replacement. But you have to be careful too because there are, if people have certain medical conditions or there is such a thing that you can actually ingest too much salt and then you can cause more issues. Like you can cause heart arrhythmias with too much sodium.
Oh boy.
So,
Doctor Show.
It's the IMA Doctor Show, and I want to touch on swimmer's itch just for a second here because what's the
too close to home.
There's swimmer's itch 2.0. It's a type of measles, right, that I've heard people start to kind of whisper about a little bit, and I guess that Pelican Lake is really plagued with it. So what are some things that parents should know before kiddos are swimming right now? Because my goodness, Amy can attest, it was horrific for her family.
So I think you're talking about what they're calling the merganser measles, which essentially is swimmer's itch. It's prolific. It's like a lot of swimmer's itch. So when I tell people, it essentially is the same thing. It's just that there are so many of these mergansers there and so many of the snails. And so there's excessive parasite in the water. So instead of getting 30 lesions on your leg, you now have 150 lesions on your leg. It's extremely itchy. It's very uncomfortable. And to be fair, there's not a lot we can do for it.
Right.
So that's kind of the bummer. The big thing is I tell parents know where you're going, right? So I mean, if you know it's in Pelican and you've heard that, I probably wouldn't swim in Pelican. Yeah. And then it comes down to the areas too. If you see birds in the water, waterfowl in the water, probably stay away from those areas. It is hard, obviously, because they bob and weave along the shores, but the other piece to that is warm, shallow water.
Yeah, so, I was going to say, if you can get to deep, cold water, you are in better with, and I had never seen it where swimmer's itch was not only just covered on the legs, but my kids had it on their arms and their bellies and their backs and their necks. I mean, it was absolutely and we did the whole thing where we scrubbed off, we took showers right away, we followed the plan to a T, right? We made sure we weren't on the shoreline, we were out further, we tried to follow all these, but even like you said, if it's there, it's there. It can find you.
And I think people don't realize, like, when it's bad like that, the minute you go in the water, it can already be going into your skin.
Yeah.
So it's great to get out towel dry, then wash with soapy water. But when there's as many parasites in the water as there is in some of these areas, and it's not just pelican, can't throw pelican under the bus. There's a lot of
it's
lakes.
a lot of them, most of them.
You can get it the minute you enter the water. I mean, it's literally seconds. The other piece to that is it started really early this year, but we had hot days early in the year, and so I was seeing swimmers itch in May, and that's usually unheard of. I mean, it's usually July and August that we see it, but so now the days have continued to be warmer.
Yeah.
I mean, it's just going to continue to get worse.
It's the perfect combination of situations.
Yes, set up for the
Disaster.
swimmer's itch disaster.
Yes, exactly. We were talking about avoiding injuries. Well, we were talking about the injuries we've seen in our own kiddos. Jessica Kuhn is with us, as well as Kathryn Gray, and we were talking about our own kiddos. You even had a summer injury over the weekend. So let's talk about that. Avoiding injuries is important. I think about playgrounds and lakes and monkey bars and trampolines was the one at my house. Bikes. What are some of the common injuries that you're seeing, and how can parents try to avoid them?
I think probably the most common are the cuts and lacerations, just kind of what we were just talking about. But there's slivers, there's bug bites, there's broken bones, unfortunately. Sunburn is a big one. I don't think we're ever going to prevent any of those, right? There's always accidents. So it's trying to reduce them by being safe. Helmet on your head when you're riding your bike, your scooter, your rollerblades, your motorcycles, your four-wheelers. I mean, that's a huge one for me, no matter the age. If you're on the four-wheeler, if you're on the bike, put your helmet on your head. I always tell kids, I can maybe fix your arm or leg if it's broken, but your head is a lot tougher to fix. And medical care right away. I mean, if you have concerns, if you look at something and you're like, oof, that's bad, take the kid in. Don't wait for a week.
Yep.
Okay, are we being, for lack of a better word, aggressive enough when we're cleaning wounds? So I think to myself, okay, if I slice my finger cutting something, it seems pretty clean, but like, where has that knife been? What has it seen, right? So I run it under water and then I put a Band-Aid on and I'm fine. But what about, and probably not, right? I probably should be doing a better job. But what about like when you take a fall in a parking lot, right? And it's like, oh, I brushed the gravel out and I think I'm fine. Are we doing a good enough job at home washing out these wounds? Should we be doing more?
I mean, you do the best you can, right? So depending upon where you're at in the situation, right, you do the best, and then when you get home, right, you should try. And, but the thing is, too, is that you, once, depending upon what type of injury, right, you don't want to scrub it so hard that you're opening wounds and bleeding again. But yes, if you're someplace where you have access to soap and water, that's the best thing. So, flushing, irrigating as much as you can. You don't want to probably put soap directly in the wound, right, depending upon what type it is, but make sure that you're cleaning it out as well as you can. So
if you can physically see stuff in there and you are unable to get it out with a gentle wash or a soak in the tub or the shower, you probably need to go in. I mean, there's times like when you're talking in gravel where you can have rocks and dirt embedded in the wound. That needs to come out. That's a setup for an infection or later problems down the road. And if the skin heals over the top of that and seals it in, it can be a problem later. So it's imperative that if you see stuff in the wound and you are unable to get it out, you need to be seen.
Yeah.
What about changing out Band-Aids? Because that's another thing, too, that I always worry about. Like, okay, well, my grandmother used to say, like, we got to let it air out, right? You got to let it air out. And so I'm like, well, do I keep the Band-Aid on overnight? Do I let it air out? Do I, is 3 days with a Band-Aid enough? I mean, are we overusing? Are we overprotecting in some cases?
So it's kind of shifted. So we've moved away from like keeping, airing everything out to keeping more wounds covered, and the moisture that you can actually keep them, the better off they will actually heal.
Okay.
So more so like on the, keeping them healed or keeping them covered with like some Vaseline per se, and then keep your Band-Aid over and keep it covered. So it generally does a better job with skin healing that way. So.
Okay.
Now, let's talk back to school. Summer's not over yet. Let's not panic yet, but we are kind of in that time where we are about in that 4-week countdown, which is scary. And you think about some of these things that we want to get done before school starts, and especially before some of the fall sports begin. let's talk about getting them in for maybe wellness checks, immunizations, sports physicals, all of that kind of stuff.
We have availability, but it's filling up very fast. This is probably, I would have to say, our busiest time of the year in pediatrics, as everybody's trying to quickly get in for their sports physicals. And it's inevitable that a lot of us wait until a month ahead and go, oh no, we need to get that done. But that's what everybody's doing. So there's appointments, but it is filling very quickly. And so I just remind people, like, if you need a sports physical, you need to call and get scheduled.
Yeah.
See where we can fit you in.
Let's get this number to you right now. Write it down, put it in your phone so you can do it later. 701-280-2033. I know you guys will both do those kinds of checkups. Also, Dr. Jennifer Jones-Dees, who's usually on with us, can get the kiddos in and checked out. What about those wellness checks? If you don't have one scheduled, like, is it, I mean, we are kind of on the other end of the calendar year as well. And you should have at least one of those a year for your kids, right?
Yes, I usually tell people once a year if you're of school age and older. From age 3 on up, you really should have yearly checks. And it's not so much, I mean, it is to check on the health of the child, to talk about height and weight. Are we growing appropriately? Are we doing the right things for our bodies? I tell people, my kids don't ever listen to me as well as they listen to somebody else, because what do mom and dad know?
Yeah.
And so it's important for them to hear it from somebody else. For whatever reason, they seem to, it's like when they come home from school and say, my teacher said.
Yes.
Doesn't matter if you told them 5 times already. So hearing from someone else is good. And you establish rapport so that if they are sick or they do have an injury, now it's a safe space to come in. It's not a stranger. It's not a new scary place. They're comfortable and confident in coming in to a visit, whether it's illness, an injury, or a well check. So yearly, they are different than sports physicals. So I do tell my patients, like, just tell us I need a well visit and a sports physical, because they're two separate things. A well visit is more of a head to toe, and I ask you about all of the things you're doing, what you're eating, how much you're sleeping, are you taking care of your body by brushing your teeth, showering, all the things. Sports physical is essentially checking your muscles and your joints and making sure that you can participate without risk in sports and activities. So we can do them together. And oftentimes that's what we do. It's just important that you indicate which one you're going for.
Sure. I don't understand why parents don't use their pediatrician more. Like, we use our pediatrician's name all the time in our house. Like, my kids want to watch more TV, and I'm like, I can put that on the list of questions you can ask your doctor. I can make you a doctor's appointment. I use our pediatrician as our scapegoat for everything. If your kids want to do something that you don't want them to do, I'm like, you can talk to your doctor about that.
As long as it's not a scary thing. Don't tell them I'm going to give them shots.
Right.
I don't want them coming in and be like, Dr. Jess is going to give me a shot.
No, not shots. I'm always like, if you want more screen time, then you can bring that up to your doctor, because your doctor is telling me that
this is what's safe.
20 to 30 minutes a day is the safest thing for your brain because it's growing so much. But if you'd like to take that up with your doctor, I can keep a note on my phone and we can use a list of questions. I'm like, more parents need to use that. You don't have to be the bad guy all the time. You can sort of make your doctor the bad guy.
Yes. Yep. 100%.
Right? I mean, and not the bad guy, like scary bad guy. I'm not saying that. Like, don't threaten shots and all of that. But like, if you have questions about what you can and can't do, then let's bring it up to your doctor. And, like, we talk about sports or risk-taking things and screen time and all of this stuff, like with our pediatrician, because like you said, they don't want to listen to their parents, but they might listen to their teacher, they might listen to their doctor, they might listen to the school nurse.
Yes.
We have a question I want to get to real quick in our text club. This person says, my 8-year-old daughter has chronic pain in her ankle. She's uber active in competitive cheer and other bouncing activities. She wears a brace. Worry or no?
Absolutely, 100%. She needs to be seen by orthopedics. So a general practitioner can see her, but I would say at that point, with somebody who's been active and having chronic pain, I mean, there are some things that can be chronic, like a Sever's apophysitis or Osgood-Schlatters, all things where it's more of, we can do some things to help prevent it or to make it better. But if it's in the ankle and having to wear a brace, at that point you need to see orthopedics, because we need to determine should you see physical therapy and strengthen those muscles? Is it something that's in your stride or in your jump that's causing this problem? Is there underlying fracture that we're missing? There can be so many different things. So yes, I would be concerned with chronic pain in a child of that age.
Yeah, that is scary stuff. Now, are people talking to you about the parasite? Is it a parasite or a bacteria that's going around that everyone's getting dehydrated from?
The cryptosporosis is a parasite.
Thank you. It's a parasite. And is it here?
I've not had anybody call with any concerns about cases. I don't think
I haven't seen anything, nor have I tested, but that's a tough one. So if you look into that, there's a lot of people who have very mild cases. So they have upset stomach or loose stools for a couple days versus the total extreme opposite end. I haven't seen any big major stomach problems recently.
Okay.
I think it's also weird, too, because it can take 14 days. The last thing I read. So I could have been like in Michigan 12 days ago and not had any problems. And now all of a sudden, Amy and I were afraid to eat salads when we were gone. We're like,
When we were at the airport, I was like, I don't know. Do we eat a salad?
See, I struggled with that too. And my kids came home and said, don't eat the raspberries. It's in the raspberries. And I was like, okay, guys, we're not going to eliminate our fruit and vegetables for the next 3 months while this thing gets figured out.
But I was like, I'm going to order the cooked Brussels sprouts instead.
Reasonable.
It felt safer. You know what I mean? Okay, it's cooked. We're good. Even last night I was like, okay, we're going to cook the vegetables. I'm going to roast the broccoli.
Oh, you can't roast your raspberries, though.
No, you can't. But you can warm them up, though.
You could.
Pro tip, that's what we make our beets with at home, and my kids like them. We use lots of raspberries. We use lots of raspberries and, cut up beets into little small cubes and, a little oil. And I even do a little bit of salt and pepper and some oil and vinegar, and then we bake it like that. Really good.
Yeah,
really
good. I suppose you could. I feel like, it's just kind of everybody's freaked out about it right now.
Yeah.
You know?
I mean, and fair, right? We are all kind of scared. Although, I don't know. It does seem like maybe they have found where it's coming from, but yeah, you're looking at me like I don't think that's a for sure thing.
I don't think so. But.
Are you accepting new patients right now as we get into this season of kiddos getting those checks before school and those sports physicals?
Yes, I think we all three of us, myself, Kathryn, and Dr. Jones-Deese are all accepting new patients.
Perfect. Okay, here's the number, people. 701-280-23. Before we let you go, and we did talk about the difference in that wellness check and sports physical. Now, let's explain IMA kids care compared to going to a hospital, because that can be the scary and weird thing for some. Well, if I go here, you're not a hospital. What if my kid has to be admitted? Let's address that concern.
Yes, so the difference is, I would say, just more individualized care. So we're not part of the bigger facilities, but we have access to them. So we can use all of their specialty clinics, and most of them take referrals from us. Insurance covers the referrals if we're listed as primary care. And both Dr. Jones-Deese and I have privileges at both of the hospitals. So we can admit, oftentimes we default to the hospitalist on call, but we all work very well together.
Yeah. I was going to say, you're kind of getting the best of both worlds when you come to IMA Healthcare. You know what I mean?
I like to think so.
Yeah. Because, you still have access to all of that, right? But you also have access to this kind of more personal, smaller clinic, not as scary to take your kids to.
Right.
You know what I mean? Easier to navigate for you. You can basically park at the front door. You can get in and out quicker. It's a more personal experience where people know you.
You get to talk to my nurse when you call into the doctor's office. It's not to a random nurse in a call center. As the provider, I get to determine whether I want to send you to Essentia or to Sanford for specialty care, whereas when you're in a big facility, you're oftentimes required to stay within the facility.
Sure.
So yes, it's a benefit.
It is a benefit.
And if you had an appointment today, you got sent home with an ice cream treat.
And sunglasses for that sun.
Yeah, it's never happened to me when I was a kiddo going to the hospital. At best, I got a scratch and sniff sticker. At best.
Well, they get those too. So.
Yeah, stickers are still a really big deal.
Do you pick the stickers? Who picks the stickers?
So, yes, Ashley, my nurse, said I actually order the stickers, but then I have a I have a list. I'll say, this is what I got today. Why? Do you want to know what I have?
I kind of am
I have
curious.
Some horses. I have some Ninja Turtles, superheroes, Frozen.
Okay, good.
Frozen's always
Pokemon.
What
else
about
do I have?
Bluey?
I have Bluey. Yep.
Yeah.
I have Paw Patrol. A lot of the kids are picking the actual animals now. So I have the pictures of real cats and real dogs and real horses. And that seems to be probably my most popular across the board for boys and girls.
Really?
Which I love them too. I mean,
Wow.
it's not so cartoony anymore. It's
Yeah.
real animals.
They want the real animals. I like
Next
that.
thing you know, you'll be like, would you like a Terry Redlin sticker?
And
Be
can
like,
send you
yes, I
home with
would.
a puppy?
I'd like the fall ducks, please.
Thanks to everyone who came out to IMA. We have a few minutes left, so if you're in the area and you want to get a sweet treat, come on over. The ice cream truck is out at the Med Park parking lot, and the kids' sunglasses are still out. So if you want to swing by and get one of those as well.
So we're not talking about, she's got matcha cookies over there too.
Oh, really?
Yeah, like all types. Like if you want like a chocolate chip matcha, if you want one with a cream cheese frosting, like there's See, everyone's head is turning over. Like those matcha cookies are hot business these days.
I guess. IMA Healthcare is located on 45th Street, 32nd Avenue South. If you want to call them later to grab one of those appointments, 701-280-2033, IMAHealthcare.com. IMA Healthcare is focused on whole person, preventative, and specialized medical care. Instead of simply treating a symptom, they're going to work to find the source of that symptom and what it means to your overall health. Our next IMA Doc Show will be with Dr. Michael Blankenship and probably a Diet Mountain Dew, and that will be coming up in August. And to Kathryn Gray and to Jessica Kuhn, thank you guys so much for being here today. Appreciate it.
Thank you for coming out.
Thank you for having us.